Good evening, everyone, and welcome to the 5th episode of the JCU COVID-19 webinar series. I'd like to start by acknowledging the traditional owners of the lands in which we meet all across the state and beyond, and to pay our respects to the elders past, present, and emerging. In a new field of expertise for me, we're going to look tonight at animals and COVID-19. Delighted to welcome Margaret Reilly and Janice Lloyd as our panelists tonight. And we'll start straight away by handing over to Margie.
Thank you, Peta-Ann. Good evening, everyone. Welcome to Companion Animals and COVID-19. So tonight,
sorry, Margie, I just realised I forgot to tell the audience. I'm terribly sorry. If you've got a technical question, please use the chat, and one of the tech team will help you with that. If you've got a question you would like to give to Margie or Janice or both, please use the Q&A little box at the bottom middle of your screen there. Thank you. Sorry, Margie, back to you.
Thanks, Peta-Ann. So tonight we'd like to give you some information about SARS-CoV-2 and our companion animals. Next slide, please. So I'll start with, what are companion animals? As a veterinarian, strictly speaking, companion animals to us are cats, dogs, and horses. But as you can see from this slide, there's lots of other companion animals that we share our homes with. So we have a little cockatiel, so many people will keep birds, pocket pets, there's rats, mice, and guinea pigs. We consider those, we call them pocket pets, obviously because of the size. You'll see some little rabbits there, a ferret. You need to be careful. Ferrets and rabbits actually can't be kept as pets in Queensland, and they come with hefty fines if you're caught with those animals. But in other states, they're considered as companion animals. And way over on the right there, we have a little bearded dragon. And people do keep reptiles as companion pets. There's bearded dragons, there's blue-tongued lizards, and also some pythons as well. And bearded dragons actually make really nice pets for children. But essentially speaking, we will be talking about cats, dogs, and horses, as strictly speaking as companion animals. People will also keep farm animals as well as companion animals. So as veterinarians today, we might treat household chickens. Some people might keep pigs. There's pot-bellied pigs, sheep, and goats as well. So that group of animals is actually growing to what we call companion animals today. Next slide, please. So we'll talk about some zoonotic diseases now, common zoonotic diseases that we will talk to our clients about every day in practice. So you'll probably know already that a zoonotic disease is a disease which can go from animals to humans. So in companion animal practice, there's quite a few of these. So we have the viral diseases like Hendra virus and Lissa virus, both of which are very nasty. And DAF have already flagged that Hendra virus could be quite prevalent this winter in 2020 because of the seasonal conditions. There's also brucellosis, Q fever, Bordetella, and I'm talking about Bordetella bronchoseptica here as opposed to Bordetella pertussis, which is the human variety of whooping cough. But humans can on rare occasions become infected with Bordetella bronchoseptica. Another bacteria is leptospirosis and also psittacosis as well. And that's a particular interest as a veterinarian as a zoonotic disease because humans may present with fever and cough to their GP, which is signs of psittacosis as well as COVID-19. So we need to be particularly careful about diseases such as psittacosis. Protozoal diseases like toxoplasmosis is a risk for pregnant women. And then we have the parasites, both internal and external. So roundworm, hookworm, hydatid tapeworm, and the fleas and ticks, etc., which not only can cause local irritation, but may also carry some infectious disease as well.
Margie, I'm sorry to interrupt. Can I just say that I'm a little bit confused? I just want to double check with you. Up at the top here, we've said a zoonotic disease is one that can be transmitted to humans from animals. So just double checking, it's your animal that gives it to you. But the other way around would be reverse zoonosis. Is that correct?
That's correct, Peta-Ann. Yes, that's right. Yes. So there's already some coronaviruses that we see in animals relatively commonly, and I might say that the zoonotic transmission to humans for most of these things is really quite uncommon, but it is our responsibility to explain to animal owners that these diseases do happen and they could potentially catch them at some point. But there are alpha coronaviruses that do infect companion animals. Coronavirus SARS-CoV-2 is actually a beta coronavirus, but there are several alpha coronaviruses that affect companion animals, and none of these are transmissible to humans. So we've got feline infectious peritonitis, and there's a coronavirus diarrhea in puppies, both of which we can vaccinate for. And I might point out that that vaccination is not cross-protective for COVID-19. Next slide.
Margie, we did have a question come through wondering, and the person wondered whether feline infectious peritonitis is a good model to understand SARS-CoV-2 in humans. What would your thinking about that be?
Not being a virologist, Peta-Ann, my instant reaction would be just the fact that it is, FIP is an alpha coronavirus, whereas COVID-19 is a beta coronavirus, and I'll leave the rest up to the virology experts. So I would expect not, but to be honest, I really don't know.
And we are having that webinar next week, the Ask the Expert panel, so that is something that we could bring to them and ask for their opinion.
Yes, definitely. Thank you. Next slide, please. So we might talk a little bit about the history of SARS-CoV-1 back in 2003. So you remember the outbreak in Hong Kong in 2003, and there was a cluster of human infections that the scientists thought they'd need to do some more investigating. So they sampled quite a few animals in this block of flats, and some of these animals were pets and some were pests, because they thought that the animals might have been involved in the transmission of this infection. And it ended up through this investigation that actually wasn't the case, that the guilty party was actually the building's drainage and sewerage system. But during the course of that investigation, they tested several animals, and 8 cats and 1 dog returned positive to COVID-1 from oropharyngeal swabs. So none of these animals were actually sick, and as far as we know, there was no transmission to humans. So the question is asked, is this a reverse zoonosis? Did these animals get it from their humans? And they may well have, but proving that would potentially be difficult. So later in that year, there were some experiments done. Cats and ferrets were experimentally infected, and it was shown that they could actually infect other animals that were nearby as well. So a naive cat could become infected when it was put in a cage next to an infected cat. None of the cats actually became ill during this experimental trial, but some of the ferrets actually showed clinical signs, and one even died. So that was a very interesting study back in 2003. Next slide, please. So if we now look at what's been happening in 2020 with SARS-CoV-2, so we knew from back then that cats and ferrets could become infected. So it begs the question, could dogs become infected too with SARS-CoV-2? So in January, the pets of infected humans were required to undertake 14 days of quarantine. So this was the opportunity for these animals to be tested. So they were PCR tested. They tested a dog and a cat, and both tested negative. The following month, so February, they tested a very elderly Pomeranian dog, and he was PCR positive on multiple occasions and also positive on serology, although he was culture negative. This little fellow never developed any clinical signs, and subsequently died of other causes, bearing in mind he was 17 years old. So sad as that is. So by last month, there were quite a few more animals had been tested. And of all the tests that they ran on these cats, dogs, and the 2 hamsters, all these animals were in quarantine, by the way, only a further 2 of those have tested positive. So there was a German Shepherd who was positive on serology, culture, and PCR, but exhibited no clinical signs. And there was a cat positive on PCR, and serology and culture are actually pending on that cat, and exhibited no clinical signs. So that brings us to March this year, where a cat in Belgium, a cat belonging to a COVID positive human, presented, and I can only imagine this was done virtually by some sort of telemedicine, because the person was in isolation, and it presented with anorexia, vomiting, diarrhea, and dyspnea. So dyspnea is a shortness of breath. So there were respiratory signs in this cat. So the owner was kind enough to collect samples for testing, and I think they collected vomitus and diarrhea for testing, and it was PCR positive. Serology is pending and a culture was not performed. And the rest of that slide has disappeared off the bottom of my screen. So the next positive infections were to the 2 cats in April that tested positive in the United States. These cats actually did have clinical signs of respiratory illness, and they didn't actually live together, and they tested positive as well. Next slide, please. So now we come to the big cats in the Bronx Zoo. So this is really quite interesting. Nadia, who's a Malayan tiger, and that photograph is not of Nadia, it's just another beautiful Malayan tiger, actually had respiratory clinical signs. So she was coughing and she didn't wish to eat. So the keepers anaesthetised her, did some tests. I think they did some thoracic radiographs, took some blood tests, ruled out other causes, and bearing in mind their location, they decided that they really should do a SARS-CoV-2 test, and they did, and it returned a positive result. So this young lady was probably infected by a keeper, although at the time it wasn't proven, but I think in retrospect it has been confirmed that she actually did catch it from a keeper. 7 other large cats in her area, some tigers and some lions, also showed clinical signs, although mild. And I guess due to the technical logistics of taking samples, these animals had feces samples tested only, and not the oropharyngeal swabs like Nadia did. And they also returned positive test results. So poor Nadia actually made the headlines because the public response was less than favourable, because they thought that at that point tests were hard to come by, and somebody assumed that a human test had been used on Nadia when tests were in short supply. But it was actually an animal test that was used on her and not a human test.
Margie, would you be able to explain the difference between the 2 tests? Because you've said nasopharyngeal swab, so I suppose many of us would assume it's the same PCR.
I think it would be the same PCR, Peta-Ann, but I'm assuming it is really just the source of the test and what they actually marketed for and who they're marketed by. So it's not as if this was a test that was removed from a batch of tests that were made for human use, if you like, as opposed to one that was made by a veterinary diagnostic company.
Mm-hmm. Thank you.
Next slide, please. So that brings us to the breaking news that the United States has reported its first SARS-CoV positive dog. Now, this is a little pug called Winston, and Winston's become quite famous because he is the first SARS positive dog in the United States. And he was living in a household where his 3 of his humans had tested positive. 1 human had tested negative, while the other family dog and cat tested negative as well. So, and he was actually clinical. He was feeling a little off colour and not eating particularly well. So I can only assume that he was tested because his humans had also tested positive as well. Next slide, please. So what are our early assumptions here? So based on work that's already been done, it's unlikely that the virus actually likes companion animals. And those that do become infected probably don't shed for very long anyway. We have no evidence that they've actually given it to a human from a companion animal. And what we do know is that the virus can be transmitted from animal to animal based on the study in cats, and it can go from human to animal, like a reverse zoonosis. So the story with the tiger and the lions, it may be that non-domestic cats have different genetic predispositions and a different susceptibility to this virus than companion animals, because they did seem to get it quite easily, bearing in mind they spread it between the 8 of them.
And that's a fascinating thought, isn't it, Margie? Do you think that it may have something to do with the load of virus that potentially those cats were exposed to, the big cats, given how severe the outbreak has been in New York?
Well, the fact that they were quite isolated, I mean, it's not as if we pick up our tigers and lions and cuddle them and come into close contact like we would with a cat or a household dog.
Yes.
So I would think, to me, it almost screams the opposite, that they're very sensitive, because I would imagine their load wouldn't have been much because they were quite isolated at that time. And are normally quite isolated from humans apart from their keepers.
Thank you.
Next slide, please. So if we talk about the diagnostics for these viral tests that we do, there's a company called IDEXX, which is a veterinary pathology diagnostic company based in the United States, and they have quite a large presence here in Australia as well. So that to this point, they've tested over 5,000 dogs, cats and horses, just routine samples, provided these animals have not been ill or suspect of being infected. They're just routine samples that they're testing, and this was all just to calibrate their test. All of these tests thus far have been negative. So they've actually released a commercial test just last month in the United States for SARS-CoV-2. It's a PCR test, but it has very strict guidelines for use. So you can't just rock up to a vet clinic with your cat or your horse and say, please, I want this animal tested. So the guidelines are the animal needs to have clinical signs. They've had to have contact with a human with clinical signs, and other common diseases should have been ruled out by this point. To my knowledge, I can't seem to find that test available here in Australia from IDEXX, but I suspect it's very close, and it will be available probably under the same conditions. The unfortunate part about testing, particularly in cats, is that they need heavy sedation or general anaesthetic, because we actually are sampling the nasopharynx, the nasal passages and the oropharynx with the swab, like we do in humans, and it's quite unpleasant, and cats aren't very cooperative with that sort of stuff. So it may be that, you know, epidemiological studies and surveillance is actually of more value than trying to test everything.
And Margie, I wonder, it would be interesting to discuss the potential of aerosol generation when you're doing those procedures, because obviously in humans, that's one of the most high risk activities we do. If you're working in the respiratory tract and the person coughs, or you're generating
yes.
A lot of aerosols. Do you think even in those circumstances, there appears to be no evidence of animal to human, so of a zoonotic transmission?
No, as far as I can tell, and I suspect that people that are doing that many tests on those animals and running that many tests, they probably are wearing PPE in those labs. But yes, to be honest, I couldn't be sure.
Thank you.
Next slide, please. So treatment and prevention, you know, we all know that this virus survives for hours and even days on surfaces and objects that can infect humans. So, you know, disinfectants and hand washing are very important and work very well to prevent infections for humans. And we know that humans can become infected by close contact with each other and also with household fomites, so kitchen surfaces, door handles, etc., etc. So it does beg the question, could our companion animals be fomites? Could they actually carry virus physically that we could actually become infected by? So the current recommendations are if an owner tests positive for a cat or a dog or a companion animal for that matter, then they really need to be quarantined, I guess, for the animal's convenience and comfort in their own home if they can be kept away from the positive human. Bathing is not required, and this is where I get particularly concerned in general practice, is if people start to try and disinfect their cats, so to speak, particularly cats, because cats groom, so any chemicals on their coat they will ingest. So particularly around disinfectant products, disinfectant wipes, I think we need to be very careful about those sorts of things. So it's actually studies that have been done with other viruses show that there's been negative PCR testing and culture from here, from these animals. So it's unlikely that they are fomites. And as far as treatment goes, there has been a lot of talk about ivermectin, and we obviously use ivermectin a lot in our world in animals for other reasons. But the fact that the incidence is so low, there's low viral shedding, very mild clinical signs, is that it's probably best at this point to wait for further information about anything that we might use ivermectin for.
Margie, just in a slight, not directly related, but very topical, there's a question that's come through from the audience about the safety of eating meat. And obviously there's this outbreak in the abattoir in Victoria. Now, my understanding from everything that you said just now is that the only possible risk to a consumer of eating meat in that situation would be if there was anything contaminated on the packaging, or, you know, there'd been some contamination that way. The actual meat itself, there was absolutely no evidence of any transmission of COVID in that way.
Yes, no, I agree. It would be from my assumption would be you'd be more at risk from the packaging on the outside than the meat itself. There's absolutely no evidence of meat being involved in the transmission of this disease at all.
Thank you.
Yeah. So now I'd like to hand over to Janice, and she's going to talk about the human-animal relationships during this COVID pandemic. Thank you, Janice.
Thank you, Marg. Thank you, Peta-Ann, and hello, and thank you to everyone listening. So I'm Janice Lloyd, and I'm going to talk to you about human-animal relationships at this time, and I'm going to talk to you about staying at home with your pets and keeping all species safe during this time as well. So a little bit on the human-animal bond, pet ownership statistics in Australia, and then some potential emerging threats to animal welfare due to the epidemic. Second half of the talk, I'll mention protecting pets if you're sick, getting your pet to the vet, and some of the problems that arise from working at home with pets, although in the main I'm sure they're absolutely delighted that we're home with them. Next slide, please. Thank you. So I'll start with just a definition of the human-animal bond. This is a definition from the American Veterinary Medical Association, and it's one that I really like. I'll just read this out. It's the human-animal bond is a mutually beneficial and dynamic relationship between people and animals that is influenced by behaviours that are essential to the health and well-being of both. This includes, but is not limited to, emotional, psychological and physical interactions of people, animals and the environment. And I like it in particular because it's very one healthy and one welfare, but I like it because I think as humans we're often anthropocentric and we put humans in centre stage, and I think more than ever now this epidemic that we're seeing, thinking more about that we're all in this together, our animals and our pets. So thinking about the other end of the leash, if you will. So we know pets are good for us. There's a fair bit of evidence that exists, albeit some evidence better than others, that people in the presence of animals are perceived to be happier and healthier, may experience decrease in blood pressure, reduced anxiety. There's some studies that suggest that people recover more quickly after a heart attack if they have pets at home, and also that children may become more, have more empathy and even become better parents if they experience the pet relationship. So we also know that the therapeutic value of animals for people who may be in nursing homes, hospitals, hospices and prisons, that's all been well documented. So we know that our pets are good for us. Next slide, please. Okay, so this slide just shows you some statistics on pet ownership in Australia, and it'll be absolutely no surprise for many of you to know that we have one of the highest rates of pet ownership in the world. These statistics are very recent. They're taken from the Pet Ownership in Australia study that was done in November last year. So greater than 29 million pets in Australia. Dogs are the most popular and followed by cats. So about 61% of households have pets, 40% having dogs, 27% having cats. So if you do the maths, and I did it earlier, that equates to about 21 dogs for every 100 people and about 17 cats for every 100 people. So as my background shows and my slide, it really is raining cats and dogs. When the study participants were asked why they got a cat or a dog, the answer is still companionship. It's very important, but over the years we see the relationships between people and their pets changing. 66% of households in Australia describe their pets as members of their family. Indeed, that term fur child, that's actually been incorporated into the Oxford English Dictionary and the Macquarie Dictionary as well, since for the last few years. So definitely a relationship that's evolving. Could I have the next slide, please? Okay, so that was some of the good stuff I was talking about. This brings me to potential threats to pet welfare that I just want to touch upon during the SARS-CoV-2. Now, Marg was talking about you know, there is a fear of zoonosis, so people it's an unfounded fear. People may worry that their animals can give them a disease. We know that's not the case as far as our evidence can tell us, but despite that, we're seeing some interesting statistics coming out of the adoption centres. So in some RSPCA centres in Australia, adoption rates have doubled, which is marvellous, I have to say. That is a good thing. We know that pets from shelters are safe to adopt, but just some things that we have to think about, or some of the risks that may happen. One being opportunistic adoption. So this is people wanting pets for companionship, and just because they're at home, they may make that decision to take a pet without really giving it the deep thought that it is necessary to be a responsible pet owner. So this, you know, you have to understand that pets have very complex behavioural, physiological and social needs, and that people have to understand their body language, how they communicate, and how to train to really look after their pets very well. So risk of abandonment, it is a possibility. I'd like to say that there have been studies done out of the RSPCA that indicated that people who adopt pets at times like Christmas, they're actually no more likely to return these pets to the adoption centres. We used to think that was the case. So that's not so much the risk of the opportunistic adoption as people having to abandon pets because they lose their jobs or they're out of work and they actually can't afford to look after them. I also have abuse on this slide, and I put that up there because of we know that in times of COVID, that domestic violence has been increasing in several countries throughout the world, and we know that there is a link between abuse of humans and abuse of animals as well. So it's just something that I think we need to be watching in that space. And then I also have up here on this slide what happens when people return to work. Our pets are probably delighted for the most part that we're at home, and some animals will become over bonded or more used to their owners being around, and this can increase anxiety when the owners go back to work. Separation distress, separation anxiety, it's potential to develop, and I will talk a little bit more about that in a later slide. So could I have the next slide, please? Okay, so this is moving on, what to do if you own pets, and it is just, I guess, a common sense approach. Until we know more about how this virus does affect pets, the advice would be to treat your pets as you would any other family member to protect them from a possible infection. Although, as Mark has illustrated, that even the risk of us giving animals anything is extremely low. Not letting pets interact with people or other animals outside the household, that can be difficult, and that might be gold standard. It might be difficult to do in certain circumstances, especially if people are essential workers and they have to be outside the house. Keeping cats indoors when possible to prevent them from interacting with other animals or people. Arguably, that is more important in cats and dogs because, as Margie was saying, that risk that cats can be infected more easily than other animals. So you really have to look after your animals and consider their environmental enrichment as well. So yes, please, walking the dog is important. It's important for people and animals, but dogs should be walked on a leash and maintaining that social or physical distancing from other people and animals where possible. Avoiding dog parks or public places where a large number of people and dogs gather, and not letting other people pet your dog. Now, when I wrote this slide, which was just a few days ago, the dog parks in Townsville were actually closed, but they have been opened subsequent to that. But I still would advise that if there's a large number of people and dogs milling around together, it can be very difficult to social distance, especially from person to person. So it's still not advisable to frequent the dog parks when they're very busy. There's lots of other issues with dog parks. It's another topic for another talk. I'm not saying don't go. I think in just trying to go when it's at certain times of the day when it's not so risky.
But Janice, I'm fascinated by this. So what you're saying is that we need to also, that dogs and cats also need to practice social distancing, essentially. Is that what you're recommending?
I'm concerned that cats would have to practice social distancing, not so much dogs, but we still don't know that much about how the animals are infected and how they might infect others. So where we can, I think we should err on the side of caution.
What about doggy daycare?
Doggy daycare, I think if essential workers have to go to work and their pets cannot be left at home alone because of separation anxiety or other reason, if they can't have someone come and pet sit for them during that time, then that may be a viable option. But again, I'm sure the daycare centres would be all over this. They would have to be very well run and keep it in more social distancing between people rather than the pets. Marg talked about the dogs probably not being fomites and the virus not surviving for long on their coats. So that probably isn't a great risk for that to happen.
Thank you.
Yep. Next slide, please. Oh yes, so I popped this slide up because I thought this was an interesting take on our shared bond with animals. And this is the example of sharing resources using veterinary equipment to save human lives. So what's been happening in the last few weeks in Australia and New Zealand is that veterinary practices have been approached to essentially we're trying to get an inventory in place, repurposing veterinary ventilators for human patients. So just finding out where these ventilators are, which practices have them, the makes, the models, the condition that they're in, and just writing an inventory just in case they're needed to save human lives. And this initially started from Italy when there were not enough ventilators and the need was recognised, and Britain started doing this, and now Australia and New Zealand have followed suit. So they're being used in the veterinary practices, they're sitting there, but we know they're there if they're necessary. These ventilators are essentially the same, they're human ventilators that have been repurposed for veterinary use, so the ICU staff are very au fait with their use. So it's a very useful resource. So what does this mean for animals? I guess now more than ever, the pets need to be up to date on tick prevention. So we have paralysis tick in this part of the world, and that can affect the diaphragm of the animal and they're unable to breathe and they would go on a ventilator. So making sure that our owners are aware that the pets have to be absolutely up to date on this sort of thing. Have enough prescription medicines to manage diseases or conditions rather, like chronic airway diseases. And extra precautions should be taken for brachycephalic breeds. Brachycephalic breeds are your flat-faced breeds, so your pugs and your boxers and dogs like that, because the owner should be very careful not to over-exercise them so that they can get into any kind of respiratory distress, especially in a climate like Townsville where it's very hot and humid.
But Janice, we were talking about these breeds a bit earlier, weren't we? And I was wondering whether there's any evidence that these breeds with the flat faces may be susceptible to a more serious course of the disease were they to get SARS-CoV-2 or indeed any other respiratory tract infection. Is there evidence for other infections for that?
And I know that Marg was part of this discussion as well, and we don't, there's no evidence that we're aware of. It's an interesting question though. I mean, the airways are shorter, so there's less protection. You know, there's our airways also protect our nasal turbinates, and for humans, our noses and our hairs and our cilia and our noses. So having less of that, it's possible, but I don't believe there's any evidence. It would certainly be something that we can look into to get that information. I'm not sure if Marg has anything to add there.
Just that if they did catch some sort of respiratory infection or virus, then I suspect they probably would, their clinical signs may be more severe because of their narrowed airways, and there is just less room when the mucous membranes and the tissues become edematous and swollen, so it will affect airflow.
Thank you.
Thank you.
Next slide, please. Okay, so while we're on the vetty things, we'll talk a little bit about getting your pet to the vet. So during this pandemic, veterinary hospitals are considered essential services, so they're still running to protect animals and public health and food animals, but they're designed, there's I'm sorry, I'll start again. They are considered essential services, and we have contingencies in place, that was the word I was looking for, to have either no contact or low contact between the humans and the veterinarian as well. So no contact or low contact vet visits, sometimes called the concierge model. That's where the client might drive up and leave the animal. They're met in the car park by the veterinary staff, and the animal is taken from the client. The client waits outside, the animal's taken inside to be examined. So yes, contact with patient, minimal contact with human. The veterinary staff would be phoning the client to get a history and to fill in other questions. So all designed to meet these social or physical distancing requirements. I think we'll also see the rise, and are seeing the rise in telemedicine or remote consulting. So this can allow an animal's care from home. Now I've got this funny little sign up here. That's just the delta sign changes in the vet-client patient relationship. It varies state by state. It's quite a big deal in the United States because they do have rules around vet-client patient relationships. The Federal Drug and Administration unit, that vets are not allowed to prescribe drugs or treat an animal unless they actually can see that animal and get their hands on. So that had to be changed. I was speaking to Margie about this earlier, and she was telling me that in Queensland there has to be an existing relationship between the patient and the veterinarian in order for telemedicine to happen.
So just to clarify that, sorry, you have to be registered. You have to already know a vet and have been there in order to have telemedicine or teleconsult with them.
Yeah, have a relationship with that veterinarian. And maybe later Marg might want to jump in about that, because Marg's on the Australian Veterinary Association and knows all the rules and regulations around that in Queensland. But as far as I am aware, yes, there has to be a relationship in place for that to happen already. So telemedicine is useful for things like bites and scratches, abrasions, hot spots, maybe very mild vomiting, but it would not be appropriate for difficulty breathing, neurological challenges, exposure to toxins, and signs of pain as well. Marg, would you like to say anything? Did I cover that reasonably well?
Yes, very well. Thank you,
okay.
Janice.
Okay.
Thank you.
So although getting your pet to the vet, so there's veterinarians are still there for your pets, but obviously it's not a time to be just going for the routine nail clip. Not at this time. Could I have the next slide, please? So protecting your pets if you are sick, again, until we know more, people that are sick with COVID, whether they think they are or they have been tested, they should avoid contact with pets and other animals, just like you would avoid contact with other people if you're in that position. So try and have another member of your household, or maybe a close family, a family friend, care for your pets while you're sick, because you should be isolating from them. And then you have to avoid snuggling and kissing and either licking them or them licking you, and whatever you do, sharing food or bedding. And personally, I would find that difficult, because it's so nice to be snuggling and petting with your pets, but it is something that we're putting in place, because until we really can get a handle on the reverse zoonosis. So if you must, some people have to care for their pets or be around animals if they're sick, depending on their circumstances. So the advice would be wear a cloth face covering and wash your hands before and after you interact with them. Okay, so if someone thinks they're sick and their pet gets sick, what should you do? Well, please don't go to the veterinarian. Call your veterinarian and let your veterinarian know that you are sick, and your veterinarian may offer a tele consult at that point, but certainly will be able to give you advice on how to care for your pet at that time. And then I've also got here, should pets be tested? That's people that may worry that should I be getting my pet tested to see if there's a potential to have my pet vaccinated? Well, it's not recommended, because there is no vaccine that is suitable for this kind of coronavirus, the COVID-19. There is a vaccine out there for coronavirus in dogs, but it's a completely different mechanism. It's for infections that are enteric and in the gut and not in the respiratory system. So veterinarians would not be vaccinating dogs with that vaccine, because no evidence that would be appropriate.
And just to go back to the testing, from what I understood from Margie earlier, I mean, it's a big deal to try and get a nasopharyngeal or oropharyngeal swab from a cat. You basically have to anaesthetize them, so then you're exposing them to those risks as well, aren't you? And
absolutely,
if they appear to not get it very badly, and you can manage them symptomatically, then it seems that a test may not be not going to change your management. Would that be about right?
I think that's very fair to say that. They don't seem to get particularly sick, if at all. So it's just, it would not be an appropriate practice to do that. Next slide, please. Okay, now I know this is a very busy slide for the viewers. I like the name, I like Pandemic Petticoat, so I popped it up. But basically this slide is just that if you do choose to download this presentation at a later time, you'd be able to, at your leisure, have a look at it, because it basically summarises what Marg and myself have said about how to safely interact with your pet during COVID-19, some of the common questions and answers, and what to know before you go to see your veterinarian. So really just for further information, and it just shows you that there are some really lovely resources out there that are freely available to the public for your information, and these ones are from the Veterinary Information Network and available online. Next slide, please. Okay, so my last slide essentially, working at home with pets. This is a big one. We have, or as I said before, our pets are mostly, I'm sure, delighted that we're working at home with them, but there can be issues as well on both sides, of all species. So it's really important to structure your day. You know, as you know already, if you've been self-isolating, it's important to have a routine and to keep up with the exercise and eat well, and have a structure to your day, because it makes it a lot easier to get through. And it's absolutely true for our pets as well. Routine is very important to cats and dogs, especially now. They're very sensitive animals. They're very good at reading our body language. They're better at doing that than we are at reading theirs. And so any changes in routine can lead to anxiety, and that's going to be more of a problem when people go back to work, and may lead to separation anxiety. So definitely sticking to the routine at feeding times, exercise, anything like that. Another very important aspect for cats and dogs is to give them somewhere safe to go, so safe spaces. So for dogs, that could just be a nice big comfy bed in a place where they're not going to get disturbed all the time. They're not going to be listening to all the Zoom meetings or listening to the Hoover and the kids running around. So somewhere nice and safe that they can get to. It might be a crate, their crate that they enjoy, the door's open, they're not locked in there. It's a place of a relaxation, not a place for punishment. For cats, it's exquisitely important for cats to have safe spaces. It's environmental enrichment for cats. Having a safe space is an important pillar for environmental enrichment, and cats that don't have them, it can lead to all sorts of behavioural problems. Number one reason for them being relinquished at animal shelters. So give your cat somewhere to go, give them a box to hide in that people can't pester them. Make that box small enough even that one cat can get in it and others can't join it, because we all need our space at this time. Supervising young children around pets, again, incredibly important. The kids are at home more often, parents may be working. The number one reason that pets get bitten is usually because they've disturbed the family dog at home, and it is the family dog that the most bites actually occur. So supervising the kids, it's hard to do all the time. So maybe teaching them not to approach a pet when it's sleeping or resting, but even teaching the children to use treats to have that animal come to them instead. And the use of barriers and baby gates so you can keep them separate when you can't be watching them all the time. Environmental enrichment, important at any time, but even more so now. So playing with your dog. Play is so bonding. It's very good for the human-animal relationship. Playing tug with your dog, playing with your cat with a remote wand toy. Puzzle toys, a great opportunity for animals to use their minds and take up their time. Giving them hiding food around the house, letting them hunt for their food and working for their food. Animals definitely would prefer to work for their food than just be fed it all in one lump, as studies tell us. And I think looking at this opportunity, this time at home with animals, is a wonderful training opportunity. Taking that time to learn new training your dogs to walk on leads with tasty food rewards, training tricks. There's all sorts of resources available online that you can do that with. And I'll just finish with the impact on the human-pet relationship, and it certainly is an impact. We're at home more often, we may be seeing problem behaviours more often, and we may be getting more annoyed about that. So just learning to teach your animals what you would rather they do, rather than punishing them for what they're doing wrong. There's enough information in this last bullet point for a whole lecture by itself. So just taking care that to worry, think about the possibility that separation anxiety may happen. So try and take time to be away from your pet during the day. Use the barrier so that they can't be glue dogs and follow you everywhere. And try and encourage a little bit of independence.
Yeah, and again, Janice, we had a couple of questions come through earlier about, you know, how to manage when your pet is just you're trying to work from home and your pet's just wanting your attention all the time.
Yes.
You will have had the same experience as I have. I've met all numbers of cats and dogs recently with the change to work from home.
Yes.
And what would your advice be to owners about that?
Well, my advice would be to understand that things have changed for them, and that they're not doing it to annoy you. They're doing it perhaps because they're anxious, because their routines have changed, and to exercise your pets, play with your pets. Your cats can't go out necessarily, so using those puzzle toys, playing with them, trying to tire them out, making them use their minds. Contacting a good trainer. There's lots of good trainers online that use science, evidence-based positive reinforcement techniques, and getting some advice there with that too. And just trying to, I think a lot of it is understanding that they're not trying to annoy you, but they're just in a different position. So again, the use of the baby gates. Don't let your dogs follow you around everywhere. If you need some time out, you can crate train them, get them to love their crates, and use all these wonderful toys and games that are available for dogs and cats to actually exercise their mind.
Thank you.
So just, yeah, I finish off with that this situation I think that we find ourselves in. That oh, sorry, could we just go back one slide, please? Was just that we are now in this position that our pets are in all the time, and we're learning what it's like to be home all the time. And I think that it's a really interesting aspect of the human-pet relationship that by us, it takes us back full circle to the responsible pet ownership. We have to realise that they're very complex beings, just like us. And I think it will help the human-animal bond, our understanding of what they're going through when we leave them at home with nothing to do all the time. So the last slide, please. Thank you. So just the latest evidence, as Marg and I have said, you won't catch it from your pet, very unlikely, but they could catch it from you. Having said that, they're unlikely to get sick, and so far there's really no evidence of transmission to humans. But thinking about how pets can be vulnerable in other ways as well, and thinking about structuring your relationship with your pet when you're working at home. So I have this little video here that I'm just going to finish on because I think it's funny. See if it works. It didn't work on my screen, so I don't know if it worked on yours.
Yeah, no, I don't think it's...
No, it didn't work. That's a shame. But never mind. It hopefully will work when on the download. So, yep, so really that's me. There's one other slide that with acknowledgements. It's all the links to information that Marg and I used in case anyone's looking for some further information. And thank you very much.
And thank you. We'll just go to the final slide, which is just an update for what's happening next week, which is we having an Ask the Experts. And come back. Just before we do that, we do have another question. We've got a bit of time. Oh, that was a thank you from, just a thank you to everyone about that. So thank you very much. Absolutely fascinating. And I've learned so much that I did not know before. And thank you to everyone who joined us and to those who are listening it as a download. And we'll see you next week.